anesthesia they are taking to patient. This is the anesthesia, okay?
Yes.
Anesthesia, there are the different type of anesthesia, the general anesthesia, the local anesthesia. Local anesthesia is used for the patient having the local problems. Suppose to say you have finger problems, we will give you local anesthesia, we will not give you the general anesthesia. In general anesthesia, the patient will be totally asleep on the bed.
Yes.
So there is the more risk chances. In general anesthesia is dangerous. We are not giving to the general because we are going to depress the total CNS system of that patient. We must through the desensitize to the specific area, but patient can see his incision and like these things. Okay, so it is about the local anesthesia. In anesthesia, the doctors break up the paralyzed and like these things. They are preventing the medication, preventing the fluids attacking like the milk or like the foods. You shouldn't give to the patient these things before 7 to 6 hours before the surgeries. If you are giving these things to the foods, or to the water to any patient, and he is going to in anesthesia, so all these things will be in emesis. If patient will do emesis, ulti karega, and this emesis position will go to the alveoli, to the airway of your body, and it will go inside your lungs. And what it will give? It will cause aspiration pneumonia. Aspiration pneumonia means somebody go inside your lungs. So it will create a more problem inside your body instead of right things. So the doctors, they are preventing a certain type of things that you shouldn't give all these things to the patient. We are going to anesthetizing that maybe the patient has more probability to 80 to 90% of emesis, and the patient will start emesis inside anesthesia, so it will be problems. Patient will be unconscious positions, and all things will go inside his alveolus and your lungs and like these things. Okay, the patient have the more susceptibility towards the death. इस वजह से मर जाएगा, इस वजह से बोलते हैं मरीज को 6 घंटे पहले कुछ मत दे दो. But your people are saying, yeah, but I can't say. So this is the main things of like the anesthesia before the surgery and like these things. I made you a minor doctors. Maybe you have some information about the diabetes, how to control the diabetes, what is the treatment protocol of diabetes, which type of test is necessary for the diabetes, what is the complication and consequences of the diabetes, and also I told you the central nervous system, brain and spinal cord, periphery systems, liver, heart, and like these things. Another one, I have also told you how to check your glucose levels by the fasting, how to check your glucose level by the random, and like these things. So these things is a very necessary